I want to talk to you today about keeping patients healthy. I want to talk to you today about things that go on outside your exam room and the incredible impact they have on the health of your patients and the patients that have not yet come to you. And then I want to talk to you about your role as clinicians, as healthcare leaders, and as community leaders. Anywhere from 50 to 60%, depending on how you count the numbers, of the folks that live in Cleveland are Black American. About a third are Caucasian, and then all the other demographics combined make up the rest. Of those people, about a third live below the national poverty level, and their annual income is about a third less than the national average. They are a little low on high school graduation, despite the fact that Cleveland has more institutes of higher education per square mile than anywhere else in the state. They are low in that area. Unemployment is quite high in that area. 60% of the population lives in a food desert. Their only food alternative is either McDonald's or Dollar General store. You can imagine trying to control your diabetes if your only option is McDonald's or Dollar General and what they're offering. Crime is an issue, which makes it difficult to go outside your house into the community to exercise and do the things that we tell people to do to stay healthy. So what are the health resources there? You know, as David talked about, we've got some of the best healthcare institutions in the world. The Cleveland Clinic has for years been ranked the top or the number one or number two hospital in the world, not in the United States, not in the state, in the world. All the royal families of the Middle East come to Cleveland to get their care at the Cleveland Clinic. But if you look at who those physicians are, remember I told you 60% of the population is Black American? 93% of the physician workforce are Caucasian. Only 6% of the physician workforce are Black American. And that has an impact, and we'll talk about that. But when you step back and say, well, how does all this come together? And what do we get with all of these resources? Cleveland ought to be one of the healthiest cities in the country right now. With all of this going on, how healthy is Cleveland? Well, they're below average on virtually every measure of community health and wellness. From life expectancy to neonatal morbidity and mortality, they are well below national averages on every single measure of health. Now, all of this is in a destination that's a global destination for healthcare. All the royal families are coming to Cleveland to get their care. There's a big lounge in Hopkins Airport to cater to these folks. There's an Intercontinental Hotel with a royal suite on the campus of Cleveland Clinic. Again, if you're going to have good health care, Cleveland ought to be the place where you're healthiest, but it is not. 1 in 6 children has got measurable lead in their blood. 1 in 6. Lead is toxic to the developing brain. Now, this is my area of expertise. And there's a direct correlation between lead level and IQ. And so what we're now seeing is generational impact. Now, remember, Cleveland is trying to reinvent itself. It's trying to be a destination for innovators, investments, industry to come in, and yet let's look at the health of the workforce, and employers are paying for that health. And more than ever, people look at quality of life in deciding where to put their companies, where to put their investments. Some patients are more impacted than others. And so this is pretty revealing. You know, this shows where people live. The black areas are where most of the Black Americans live. Look at where the disease is. Darker purple is higher prevalence of disease, all causes. There's several factors. It's multifactorial. And I'd ask you to think about this for your own community as you go forward. The first is what I call the sins of the fathers. So remember I told you that Cleveland was a destination city after the Civil War? So all the freed slaves from the South came to Cleveland because of job opportunities in the garment industry and later then the steel industry. Eastern European immigrants came to Cleveland because of the same reasons. But let me tell you, the industrial titans that lived on Euclid Avenue did not invite them into their neighborhood and sectioned the city off so that these people had to live in certain areas. Structural racism was very prevalent in Cleveland at the time, and we are still living with this today. To show you how bad this was, over time, the industrial titans went and lived elsewhere. These are huge mega mansions they had built on Euclid Avenue. Instead of giving those to the city for poorhouses and things like that for people, for the city to use to take care of all these people, they tore them down. There's only 3 mansions left on Euclid Avenue today from people that did not tear down their mansion. That's how bad things were back in the past. They forced people to live in certain areas away from them, and then that has continued and persisted to this day. And there are really good studies that show that if you're a Black American patient and your doctor doesn't look like you are up to 60% less likely to follow their advice. So how does that work with chronic disease? How does that work with screening recommendations? How does that work with keeping people healthy? We're building a health campus. I'm on the board at St. Vincent's. We're building a health campus, which is right smack in the center of all these underserved neighborhoods. There's going to be a food pantry there. There's going to be childcare for folks that'll be free. There'll be a variety of different things to take the patient holistically, because in medicine, we've tended to start to look at the patient by specialty. We really need to step back and say, let's look at the patient holistically and how we make a difference to them. I was privileged to start a program called Pathway to Practice to get more of these disadvantaged, underserved minority students into medical school. And it involves going into the high schools and in some cases the middle school and getting them interested in medicine and providing tutors to give them that STEM foundation. Every single one of the students that we reach to gets a physician mentor. One of the physicians in the community mentors them and is a role model and a guide for them. And then we give them wraparound services. Many of those students are breadwinners for their families or holding down jobs. We give them coaches and financial counseling. We provide them tutors free of charge. The Kaplan course we provide free of charge. We pay for them to take the MCATs. It's expensive to take the MCATs now. And then we pay for their application fees for medical school. We give them money to buy a suit to go for an interview. And then with that, they do rotations in urban health to get them interested in the needs of Cleveland so that when they finish their residency, they will come back to Cleveland. So bringing together these types of things with partnerships with the community can make a big difference. What is the health of your community? Do you know? I'll tell you, it was a real eye-opener for me coming home to Cleveland to look at this and realize, holy cow, we got all this great health care and all these amazing challenges. There really are haves and have-nots. When I look across the nation right now from the positions that I serve in right now, what I just talked about with Cleveland is true of many, many other urban areas right now. So this is a challenge because all of us want to have economic growth. All of us want to grow as we come out of the pandemic. But as David talked about, healthy economies are built on healthy communities. Cleveland, as you heard David say, ranks 157th. So who's going to come to Cleveland? So if we want to come out of being a Rust Belt city and grow and be that economic engine that we want to be in the Midwest, we've got to deal with community health. Where does your community rank? And what are you doing about it? One thing that you can do today is be part of this registry. I think this is a phenomenal initiative to really get our hands around a big killer for Black American males, and then use that model to expand to other chronic disease states. So be part of that. And then how are you as physicians and healthcare leaders working in your community and advocating for patients that may not have come to your exam room yet, but are nonetheless in need? We all take an oath called the Hippocratic Oath, and a phrase in that Hippocratic Oath is primum non nocere, first do no harm. Does that only apply to physicians or to patients in your exam room? Or do we have a broader responsibility in our community? And I would say that we do have a broader community. So I challenge you to think about how can you make a difference? We like to think we're the end-all be-all and what happens in our exam room is going to keep our patients happy. I will tell you, the key to success, the key to health, the key to longevity and good life for our patients rests in the community. Be part of the solution. Thank you very much.